Thank you for joining us today for the meeting of the New York City Health and Hospitals Capital Committee. Today's meeting is officially called to order. Please note for the record that Karen San Hilaire is representing Molly Wasso Park in a voting capacity. So I would like to propose a motion to adopt the minutes of the Capital Committee meeting held on November 4th, 2024. Dr. Katz,
Yes.
Frida Wang,
Yes.
Karen San Hilaire.
Yes.
Motion is adopted. Next, we will hear the Vice President's report, Mr. Saiz.
Thank you very much. Good morning, everybody. We are starting the new year off with the movement on several key projects throughout the system. At Woodhull, we have been given a notice to proceed to our design build vendor for the work on the labor and delivery birthing suite renovation, and we are anticipating to start construction this year. Also at Woodhull, we have started design on the nuclear camera upgrade and are on the way with the OmniCell point of care implementation. At South Brooklyn, we have been given notice to proceed to design build vendor for the women's health work. And at Elmhurst, we have started the exciting work of our emergency department expansion phase 1, which is focused on the administrative space, which started construction, and we've completed two additions to our central sterile, a cart washer, and an air handling unit. At Lincoln, we have completed our new Lincoln Doctors Library. It came out very nice. As well as our emergency electrical systems upgrade. We are in active construction of the parking lot garage with an alternative parking garage with a jitney service to provide to staff during the construction. That is critical work that needs to happen there. We have one item today, a preventative maintenance contract for our fire alarm systems, and with that, I'll take any questions.
What's the Lincoln Doctors Library?
I'm sorry?
What's the Lincoln Doctors Library?
So they had a medical library that was located on the second floor for years. It's been relocated to another more amplified space for them. And it's been completely rebuilt with new technology and just a much more comfortable space for them to operate.
Like electronic now, largely? Or
Well, there'll still be some hardcore text, but it is mostly electronically fed, yes. Very nice space.
Thank you.
Okay, any other questions or comments? Thank you for your report, Manny. Can we go through the resolution? Can you read it into a record?
This is authorizing New York City Health and Hospitals Corporation to execute a contract with FireMax Systems Corp. to undertake mandated inspections and testing of the fire alarm and fire protection systems across all acute and post-acute care at New York City Health and Hospitals facility for a contract amount of $4,453,875 with a 20% contingency of $890,775 to bring the total cost not to exceed to $5,344,650 starting in April 2025 with a term of 3 years with 2 one-year options. A little bit of the background. New York City Health and Hospitals is mandated quarterly, semi-annually, and annual inspections of testing of all of our fire alarm system and fire protection systems. Vendors are required to perform fire safety services across all of our acute and post-acute facilities that include preventative maintenance and testing, repairs, documentation, panel programming, inspections, and also testing. The current agreement with FireMax originally expired on December 31st of 2024. In order to complete the RFP, the agreement was extended through April 31st of 2025. The extension value was under $1 million, so consistent with the OP 100-5, the agreement extension was approved by supply chain. The contract spent between 2019 and 2024 is $6.2 million, 5.4 in PM, 859,000 approximately in repairs. FireMax provides services at all H&H facilities. Other than the selected number of Gotham sites, are services completed by the landlord. And with that, I'll hand it over to Manju, who will take us through the procurement.
Thank you. Next slide, please. So this is our standard minimum criteria, standard substantive criteria. The evaluation committee was made up of a number of our site director of engineering, our chief engineers, and also a member for finance and EITS. Next slide. Quick overview of the procurement. Back in May of last year, we received approval from CRC to issue an RFP to City Record. The RFP was posted to City Record and sent directly to 3 vendors. Pre-proposal conference was held. 3 vendors attended. 1 proposal was received, and FireMax was the highest rated proposer for the RFP. Next slide. This is the contract budget. So as Manny mentioned, the base contract is $4.4 million. There's a contingency of 20%, which is standard in most of our preventative maintenance contract. And the reason for this is, they're typically 5-year terms. As we add equipment or we have any emergency service needed, if we only came for the NT for the contract, we'd have to come back to the board each subsequent time for, $50, $100, $1,000 over that budget. So the 20% contingency allows us that authorization that we can access as needed for these emergency repairs or any new equipment that's added during the term of the contract. And the total not to exceed amount is about 5.3 million. Next slide. We worked with our vendor diversity team to identify a 20% goal. They have NRM systems, which will do some admin work and logs maintenance at the facilities. Firemax for their current contract is at 16% utilization, which is satisfactory based on where they are with the term of the contract. Next slide. This is the vendor performance, excellent to date. Next slide. And this is the resolution. Happy to take any questions.
Questions?
Thank you. Thank you. The first question, they were top rated because they were the only.
Vendor.
I'm just curious, why do you think there was only one proposal received?
So we actually worked with supply chain to reach out to the other three proposers. Two are not interested, and one didn't seem to understand the RFP scope very well, and we had multiple communications with that vendor to try to clarify questions they had, and they still seem to struggle with putting together a proposal.
I see. And do you know why the other two were not interested?
They didn't elaborate. No.
Okay. But do you have any concerns about the depth of the pool, or?
Not really. I mean, Firemax has been the incumbent for at least 10 years, and as you saw from the evaluation, they performed excellent to date. So they perform great service. They're very responsive. So we haven't had any issues with them.
That's good. And I noticed the contract amount is lower than what we spent in the prior contract.
So there were some equipment that were retired or switched over to another system, so they're not in Firemax's scope. So as a result of reducing the overall equipment system-wide, the price went down.
Oh, interesting. So do you mean somebody else is maintaining that now?
Yeah.
Oh, okay.
So we have some proprietary systems like Simplex, Grinnell, which JCI maintains, and Siemens. So in those cases, when they're switched over to those systems, those contracts are with those vendors.
Okay. Thank you. Great.
Any other questions? Okay, let's take it for a vote. All in favor, please say yes.
Yes.
Opposed, say no. Resolution approved. Thank you so much.
Thank you.
Manny, thank you, Menchie.
Thank you. Are there any old or new business to come before the committee? None. Meeting adjourned.
That
Thank
might
you.
have been the fastest.
Thank you.
This meeting is no longer being recorded.